Good day and welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabir Schuster, State Director of AARP in this territory. And as always, it's a pleasure to have this conversation with our guests for your benefit, for your education, for your knowledge. And especially as we continue dealing with this pandemic of COVID 19, we are hoping from AARP to you that you remain safe, that you continue to follow all of the guidelines of our local Department of Health, of the government of the Virgin Islands, of the Center for Disease Control, the CDC. And we look forward to being able to join with all of you again in person once the pandemic starts to lighten up. As you may all know, AARP is no longer doing any kind of in-person events because we don't want to bring out, especially our membership, the 50 plus population who are most vulnerable, to have them exposed to this virus. The Virgin Islands Hospitals and Healthcare Facilities Corporation announced in August that effective immediately it will require all employees, including contractors and volunteers, to be required to get the COVID 19 vaccine for the safety of patients, or they could face termination. The Virgin Islands Hospitals and Health Facilities Corporation decision to implement a vaccine mandate comes as the territory is battling a surge in COVID cases that have since seen more than 65 fatalities. While it's estimated that 55% of the total number of staffers at both hospital facilities have received at least one dose of the vaccine, many in the community are protesting against the mandate, including some of those employees. Today, we are joined by Dr. Louis Amaro, who is the interim CEO of the Schneider Regional Medical Center on St. Thomas, to discuss the mandate and the reality of COVID-19 pandemic on the only safety net hospitals or hospital on the St. Thomas St. John district, including that on the St. Croix district, the Governor Wang F. Louis Hospital and Medical Center. Good day, Dr. Amaro. Welcome to the show.
Hi, good day. Thank you so much for having me. Appreciate the invite and looking forward to a very interesting talk.
Indeed, indeed. And thanks to you and your entire staff and also the staff at Wang F. Louis Hospital for being the front line during this pandemic. You are where the rubber hits the road, right? Where the rubber meets the road. And you all are working around the clock to save so many Virgin Islanders and healthcare providers all over the world working together to save humanity in the face of this great pandemic. So thank you to you and your entire staff. And tell us, what is the atmosphere like in the hospital? It must be very tense. It must be very distressing and saddening.
Well, it has its ebbs and flows, and I appreciate that. And I do want to dovetail on what you said. These are, in my eyes, real life heroes that work in the hospital. They know that it's a germ war. You have to be on your P's and Q's to be able to protect yourself and not allow a situation where anyone would get exposed and infected and potentially risk dying from this disease. But the atmosphere in the hospital has really gone through quite a bit since the start of the pandemic. From the time when there was little knowledge about the COVID virus and what it could do and how well we could protect ourselves in the very beginning of the pandemic, to now where we're all been present. And, we are now a lot more knowledgeable and I think can face it with a lot more confidence, despite the danger that still exists, knowing that if we utilize all the tools available to us to protect ourselves, we will be safe.
I have a niece who is a registered nurse and she works in a hospital in Tampa, Florida. And she graduated from nursing school just before the beginning of the pandemic. So this was her entree into the nursing profession. And she told me recently that the ward that she works on was converted into a totally COVID-19 ward. It's not the ICU, but it's like the ward of first entry kind of thing for the COVID-19 patients, and then many of them do get transferred later on to ICU. And my niece was telling me that she and so many other nurses even have to receive psychological counseling to deal with this whole issue of the pandemic and the way they see people suffering and see people dying, and it's so very hard for them. Do we have that kind of service available to the nurses here in the Virgin Islands so that they can receive counseling to deal with the emotional strain of this pandemic?
Yes, I mean that it's a very necessary part of what we do. Not only maintaining our physical health, getting the sleep we need, good nutrition, but mental health is a huge aspect of having a stable workforce, and addressing the issues. I mean, as being a healthcare worker, you are not foreign to the issues of folks dying and illness and sickness and all that sort of stuff. But the pandemic has totally reset that whole thing to a new awareness where you're seeing folks dying at unprecedented numbers. You're seeing your colleagues sometimes die, your friends, your family, young, old, folks that were never sick, were in the best of health. You're seeing those individuals die. And I'm sure that we are all of some way aware or familiar with a person, be it here or throughout the United States, who has met that type of fate. And so that wears on a person's mental health strength. We have instituted our psychologists to make sure that they round as well as, able to see these individuals, our clinical workers and stuff, to be able to, you know, express everything, allow them to scream, shout, cry, talk, that sort of stuff. Senior leadership under my watch as well makes rounds on a regular basis. We make rounds on the weekends, the holidays, days and night for our night staff as well, so that everyone knows that we're in touch. We are there with them. We are there to support them. What they're going through is a natural type of thing, and it's really important.
And we're so grateful, at least those of us around the world who have been vaccinated and those who are looking forward to being vaccinated, so grateful to the medical arts, to medical technology for developing this vaccine. It's the only tool we really have to fight this pandemic effectively. And I'm so happy that I was able to get both of my shots a long time ago. I even got my third one already because I'm a cancer survivor. I survived stage 4 cancer with bone marrow involvement, and so my doctor encouraged me to get the booster already. And so I'm still staying home as much as I can, wearing my mask when I go out, using hand sanitizer, all of the precautions. But it's such a blessing, and yet at the same time we see that there's so many people who are fighting against the vaccine, who are vaccine hesitant or even vaccine opposed. And so for that reason, we understand that the hospitals mandated that all of their workers become vaccinated. So can you tell us a little bit about the specifics of that mandate?
Absolutely. So to everything that you said, you're correct. This vaccine has come out. I will go further than to say it's our only tool. It's an additional tool. Certainly, masking, social distancing, hand washing, and all those sort of things provided very, very good, consistent avenues of protection. But here comes the vaccine, which is a huge tool to add to that armamentarium in fighting the virus and protecting individuals not only in the hospital but out in the community. And it has demonstrated in this time that it's been present a whole lot of effectiveness. I mean, it is, even here in our own territory, only the unvaccinated or the incompletely unvaccinated or the incompletely vaccinated are really what you're seeing in our hospitals, really what you're seeing in our ICUs, and really what you're seeing dying. That may not hold forever because there's no perfect vaccine, but it's certainly effective. And so in that, the hospital board, once it's shown this level of effectiveness, decided, you know, just like every other vaccine, tetanus, MMR, chickenpox, that we've mandated as a process of employment and onboarding, we have to add COVID to that because we have to protect our staff. We have to protect our patients. It would be a tragedy to give a patient COVID from a staff. We can't lose staff to these infections and have no one to treat our patients. It becomes extremely important.
Yes. Just an apology to our listening audience. We've been having some issues with internet on both sides, and so every once in a while our voice may drop out. But you're back with us, right, Dr. Amaro?
Yes, I'm back. If you can hear me, yes, I'm back.
Yes. Yeah, I believe we heard almost everything of what you said. Just once in a while, it seemed to drop out. I'm not sure if it was my end or your end, but for our listening audience, I'm sure they could understand the challenges of technology, especially during this pandemic. It seems like things have become a little more topsy-turvy. And so again, for us to understand, so the hospital board has made this mandate. Now, how much time was the staff given to get vaccinated before they actually get terminated? Was that detail spelled out?
Yeah, so the initial mandate came out on August 4th, and it had some pretty close timelines. The leadership of the hospitals went back to the board and wanted to afford the staff a little more time to get it together, basically be able to wrap their minds around it and know what we had to do. The board was flexible with that, and the policies showed flexibility where everyone was mandated to have at least their first shot by or before September 1st, and they should complete both vaccines by or before October 1st. Within there, of course, is an ability to create an exemption, be it religious or medical, for some that may not be able to get the vaccine. But and there were dates related to those exemptions as well.
In a CNN article dated September 9th, 2021, it's written, I'm quoting, and Biden, referring to President Biden, announced he would require the 17 million healthcare workers at facilities receiving funds from Medicare and Medicaid to be fully vaccinated, expanding the mandate to hospitals, home care facilities, and dialysis centers around the country. And so it would occur to me that mandate from President Biden would also apply to the hospitals here because you do receive monies from Medicare and Medicaid. How has that affected the debate with the nurses' unions and those who are protesting?
And I appreciate that. And as you know, this is just September 9th. So it's really, relatively just about 5 days ago that this came out, that we haven't had a lot of conversations or responses quite yet. However, this is groundbreaking. This moves the needle totally towards the direction that we definitely wanted to see, because it levels the playing field. All hospitals that accept Medicare and Medicaid now have to fall in line, as basically everything that we do from a regulatory standpoint is to fall in line with the mandate CMS or the Centers for Medicaid and Medicare and Medicaid Services puts out to stay. That's about roughly 2/3 to 3/4 of the payments that support hospital operations, okay, is Medicaid and Medicare services. So that's not a fragile type of statement. That is a powerful statement saying that if you want to exist as a hospital, you have to fall in line with the mandates that this regulatory body puts out. And now what they've added is the mandate of having vaccination. There's a lot of details still to come out. We don't know where exemptions may stand with that. We don't know where timelines may stand with that. But it certainly demonstrates that every hospital has to jump on board and has to have a vaccine mandate to protect the patients and to protect their colleagues.
And since the initial mandate that the hospital boards instituted locally here in the Virgin Islands, have you seen an increase in vaccinations among the employees, or are they still um, hesitant or resistant? Are most of them complying? What have you
Yeah, I
seen?
mean, we've seen approximately about, roughly a 20-25% increase in vaccinations since that mandate. So it has been fairly successful. We were just above 60% when we started the mandate. We're roughly about 84% now vaccinated within the organization. We have 443 of our roughly 560 employees. We have about 443 vaccinated individuals with 80 exemptions. And that's clinical and non-clinical. So it's the mandate has done its due diligence to increase the numbers. I mean, if you look at 80, over 80%, that's relatively herd immunity. But we want to get as close to 100% as possible, unless you really cannot take the vaccine. You really should be vaccinated, because it is definitely a tool that helps to protect the public, and it helps to protect your colleagues, and it helps to protect you.
Earlier in our conversation, you mentioned that the vaccine is one of the tools to quell the pandemic or even bring it to an end. One of the other tools is treatment, of course, to help those who have contracted to survive and then develop antibodies, et cetera, naturally. And so one of those tools was monoclonal antibody treatment. Is that still being utilized? Is it still effective? How effective is that against the Delta variant?
Yes, it is still being utilized. It is actually very effective. I would say to date, we have administered roughly 515 monoclonal antibody treatments. For the month of September, we've administered, I would say, roughly 28 to date so far. August so far has been our highest month. We administered 196 treatments in August. And, this is, I'm not sure a lot of individuals realize, but this is pretty much the same treatment as vaccinating. It's the same theory of using antibodies to vaccinate, except these are antibodies that are created. The monoclonal antibody are antibodies created to neutralize the virus, whereas the vaccination is administering a medication that allows your body to create that antibody to neutralize the virus. So if you gave me a choice of being infected and having to utilize a monoclonal antibody versus, allowing my body to create its own immunity in the very same light, I would choose a vaccination. That's what vaccination is. But the monoclonal antibody is still in use. We're still administering it. It has been extremely effective in reducing hospitalizations and ICU stays. Without it at this point, especially given the Delta virus and how that ran through our territory, I think the hospitals would have been in huge amount of trouble trying to battle this, the sheer numbers of individuals that got sick.
And I'm so very glad that you made that comparison and distinction between monoclonal antibody treatment and the vaccine. Because there's so many people who are vaccine hesitant but are willing to do the monoclonal antibody treatment, thinking that it's more natural. But really, that's the more unnatural way, because you're receiving laboratory created or somehow created antibodies injected into your body, infused through intravenous infusion, whereas the vaccine spurs your body to make its own natural antibodies against the virus. So of course the vaccine is the more natural route if you're looking for for the
I
most
would,
natural of the two, right? Yeah, and so hopefully people will come to understand that and opt for the vaccine to hopefully prevent themselves from contracting the virus, rather than contracting the virus and running the risk of death and hoping that the monoclonal antibody treatment will work. While it's very effective, I'm sure it's not 100% effective in saving lives.
and that is correct. Nothing is, but you always weigh benefits versus risk, and the vaccine has that pyramid as far as most effective, and being able to prevent disease and being able to keep folks from even catching the disease. But it's not meant to be 100%. You won't, a lot of folks that don't want the vaccine jump on, well, I know individuals vaccinated and they still get sick. Like the flu shot, like the other shots, it's not going to prevent everyone from getting sick, but it is going to reduce the amount of people getting as sick as needing to be in the ICU or as sick as, risking death, and help folks to recover. So I can recall a couple of years ago, I had my flu shot and I still got the flu, but it lasted with me one day. It was a horrible experience. It was a really bad flu, but I was up and over it after one day. Where other individuals, as a physician, as you know, I'm a physician. I know a lot of my patients who get the flu and they're out for a week, they're out for 2 weeks. They're really down and out. And I'm talking about individuals that don't even necessarily get to the hospital stage, which, the flu still kills. That's why we still need to use our flu vaccines. But it reduced my level of illness, reduced the length of time that I was ill, and I was up and at it. I was sick on a Friday and I was back to work on Monday.
That's fantastic. Yeah, well, again, we're so very pleased that we have the medical arts. I often think back to the Spanish flu. I don't know how they did it back then. We're so much more advanced today, and yet this virus is still giving us a run for it, huh? But
Yeah.
if it weren't for the medical arts, I think we'd be in a much more serious problem. Now, on the U.S. mainland and all over the world, really, we keep hearing reports of hospitals being overcrowded, ICUs being full, patients who are coming in for chronic and even somewhat acute care being turned away, having to look for other hospitals. How are we doing here in the Virgin Islands? Are we able to keep up with the demand?
I'm so glad you highlighted that because, in a small territory surrounded by the Atlantic Ocean, you feel like it's only here that those stories are occurring, or you think it's bad, but you really don't realize even the largest hospitals across the US are facing very similar type of situations. We have been able to keep up. Here at Schneider Regional, very early in the pandemic, this leadership team was able to create a COVID unit. It's approximately a 50-bed COVID unit with negative pressure capabilities to be able to house just a COVID population if we ever got to such numbers. We were able to create a fast track unit to be able to rapidly triage COVID patients and get them up to the floors or get them discharged if necessary in conjunction with the Department of Health. So we did a lot. One thing I think was to our advantage, as opposed to hurricanes where we get hit first before the mainland, and we basically have to deal with that. Most of what we've seen with COVID has hit the mainland first and given us a chance and an opportunity to prepare. This leadership team took a lot into account in seeing what was happening. As a physician, I have a lot of colleagues in the United States, so I was able to have a good network of information coming to us. And so we were able to prepare. We were able to prepare with infection control practices, prepare with masking, prepare with all the necessary things that have kept our numbers under control. I shared it with the governor. Policies were made and put in place, including the no mask, no service policies. All these sort of things came into play that kept us under control. And so the hospitals, even though we were at the brink of our capacity being challenged, we were still able to manage. Every hospital is staff challenged, so we are too. But I'm very proud of my staff that they've been able to stem that and get over that peak and that tide, and we're back under control again.
Fantastic. And you mentioned about staff challenges, and I'm certainly well aware of that, having served on the hospital board myself for a few years. That's always been a significant problem for us, even in the best of days. Taking that into consideration and the vaccine mandate that's imposed both locally and now federally, and the fact that you said approximately 80% of the employees are now vaccinated, what if, let's say, even 10% of them end up getting terminated because they simply refuse to get vaccinated? Uh, do you have any stopgap measures in place, or are you preparing that to deal with an even greater shortage in nursing and hospital staff?
Yeah, I mean, that became a huge concern and something that I voiced to the board as we worked through how we were going to implement the mandate, as we worked through how we were going to achieve success and not hurt ourselves with the same policy. And of course, the Department of Health has been extremely helpful with being able to procure staffing, with the powerful staffing that has come in. They've been a huge assistance to the organization in being able to man the forces and keep things going so that we don't see the tragic nature of losing that staff and then being totally understaffed. So we keep our fingers crossed. We continue to work it. We've been very successful thus far. We can't afford to lose employees. We're not replacing them with Parford, but certainly we have to continue to operate and we have to continue to function. So when the need arises, we use travelers, we use outside staff to fill the gap if that's what has to happen. But our goal, and it's very important that we get this word out. Our goal is our own staff. We want them to stay. So we do everything in teaching, educating, counseling, talking, doing everything, because as much as the mandate talks about termination, that is not our goal. We don't want to see anyone terminated. We don't want to see anyone leave the organization for this. We want our own to stay. However, we have to continue to function.
And we're almost out of time. We just have about 2 minutes left. But just very briefly, are you able to help the British Virgin Islands?
Um, as a hospital, we stood prepared that if actually, so this is something that actually gets up to the executive level in the nation. The president would have to be able to allow for that type of transfer of help to happen if we were going to accept patients. We were prepared to. I have been in constant conversation with the chief medical officer in the British Virgin Islands, that we were prepared to help with oxygen needs. We were prepared to help with taking patients if we had to. Certainly, the Department of Health has been very, very involved with assisting with vaccinations, that sort of stuff. So we were prepared to. We haven't had to take any patients, and luckily and thankful to God that they were able to get some level of control, although this virus is still running rampant.
Yeah, fascinating conversation today. We're just about out of time. And to our listening audience, you've been listening to me, Troy Deshabir-Schuster, State Director of AARP in the Virgin Islands, and Dr. Louis Amaro, the interim CEO of Schneider Regional Medical Center in St. Thomas. Thank you so much, Dr. Amaro, for being with us and bringing us this important information. And thank you and your staff again for all that you're doing to help us here in the Virgin Islands, to save us, to restore us to health. And we wish you and your staff all the very best.
Thank you. Thank you for having me. I appreciate it. And, good luck to all. And please do get vaccinated.
Excellent. Thank you. Good day.